Is it retinoblastoma is the question that we're trying to answer today through this case. So let's quickly go over it. This was a 3-year-old boy. He was brought by his parents to our center, and the chief complaints were that they noticed an asymmetry between both the eyes, and the right appeared smaller than the left. This was since 2 years, and since past 6 months they had also noticed an upward deviation of the right eye with a whitish reflex in that eye. So in the past history, the child had a history of meningitis at the age of 3 months, which resolved after treatment. There was no other known systemic illness at present. There was no history of trauma nor any significant family history. So the ocular examination, the right side eye did not follow any light, and the eyeball appeared smaller on gross examination. Rest of the lids, conjunctiva, and cornea were normal on both sides. So we went ahead with examination under anesthesia, and this is what we saw. This was a red cam image. There was this thick membrane which was seen in the posterior segment, but there was no definite mass. So as the next logical investigation, we went ahead with an ultrasound B scan. It confirmed the presence of a small globe in the right eye. Again, there was no definite mass that was seen. There were some thick membranes in the vitreous cavity. There was some doubtful calcification based on the high spikes that were seen on the ultrasound, and the left eye was normal. So then we went ahead with MRI for more information regarding this mass. So the axial length was considerably reduced in the right eye. And then again, you can see over here on the T2 and T1 weighted images, the T2 showed some hypointense membranes that were also observed on the ultrasound, and they were hyperintense on T1, and then there was some mild diffuse thickening of the sclerouveal cords. There was choroidal calcification, more pronounced on the temporal and nasal aspect, and there were some enhancing plaque-like lesions along the choroidal surface. The left eye was completely normal. So now what next? So the clinical findings were not really suggestive of retinoblastoma. I mean, the MRI, the imaging, there was no definite mass. But then we also wanted to rule out retinoblastoma. In this case, the child had presented with leukocoria, and we had had instances earlier where these patients, later on, they don't show any evidence of retinoblastoma at presentation, but few months down the line, they come back with a definite mass, and, it looks more likely like RB. So we thought, okay, let's just go ahead with the genetic testing. And the right eye, the VR was extinguished. There was no visual potentials. When we did the genetic testing, the NGS for the RB1 gene, it showed that there was a heterozygous deletion on chromosome 13, classical of retinoblastoma, and then the genetic report came out as positive, and this RB1 deletion was classified as likely pathogenic. So now, is it retinoblastoma?
Let's look at the picture again.
Red cam, ultrasound, MRI, and genetics.
Well, I mean, a photograph is limited. The question is it a diffuse infiltrating kind of retinoblastoma, if at all?
Yeah, so this was a 3-year-old child, not that, not an older child. And the anterior segment was also normal. There was no inflammation in the anterior segment. And then there was some doubtful calcification on ultrasound. So these were some of the features that were going against a diffuse infiltrating RB. But yes, with a thickened membrane like this, we would definitely consider a diffuse infiltrating RB as a probable differential.
Are there any seeding in the vitreous?
No, this was it. It did, but that's why we were surprised at the genetic testing. So we,
Could be incorrect genetic interpretation.
yes, so that's also one of the possibilities, that it could be incorrect genetics. But then, like, what do we do? Is it retinoblastoma? So we just, like, had this series of patients where, retinoblastoma was misdiagnosed. So this was about 208 series of about 280 cases, all of them enucleated at our center. So all these 280 enucleations were done for retinoblastoma. And but out of these 280 cases, 4 cases didn't turn out to be retinoblastoma on histopathology. One was granulomatous endophthalmitis, one was a retinal astrocytoma, one was Coats, and one was PHPV. So 4 out of 280, almost 0.4% of cases where we misdiagnosed retinoblastoma, and finally it was on histopathology. But then these were all very closely simulating lesions, and all the imaging that was done in these cases were suggestive of retinoblastoma. That's why we went ahead with enucleation. But the point is that yes, we can, enucleate an eye which doesn't have a retinoblastoma, and later on histopathology, we get to know it was something else. So now the points to ponder in this case: how significant or accurate is this genetic testing result? Is it retinoblastoma? Should we go ahead with enucleation or not in this situation? And even if it's not retinoblastoma right now, if we assume that the genetic testing is correct, is this child at risk for developing retinoblastoma in the future, which is why we should go ahead with an enucleation right now? It's a non-seeing eye, it's unilateral, the other eye is normal. So how should we proceed?
Before you get into any of it, I want to know, is this test clinically validated? Do you know false positive and false negatives in this test before you clinically apply?
Okay, so
Have you done it on 100 cases of RB and 100 cases of not RB, and you know what it shows, what are the predictive values? You need to know all that for this test before we start to rely on it.
yeah, so we're not sure whether we should rely on it or not. So that's a very important question. And we contacted the lab when we got this genetic testing result. And we tried to find out from them what is their sensitivity, specificity, what would they suggest. Because clinically it is not looking like retinoblastoma to us. So what they told us that they have done this, this targeted RB1 sequencing. Yes, Rita?
Why did you perform RB1 mutation in unilateral cases?
Yeah, that's a good question. In fact, we didn't want to miss a retinoblastoma. That's why we were not expecting, to be very honest, that we will get anything positive in the genetic testing. We explained to the parents that it's unlikely to be retinoblastoma. You can remain under follow-up, but they were coming from very far away, and they wanted, like whatever possible investigations to rule out a retinoblastoma. So that's why we offered. We said that okay, you can undergo genetic testing. There's no harm. If we get a positive result, maybe it will, help us in our clinical management. If we get a negative result, then maybe we'll be more sure that it's not a retinoblastoma, and we can just keep you under follow-up.
So what did the company say?
Yeah, so the company said that we're always right. We're always right.
You have to produce some data.
Yeah.
Okay, this is
So,
very important.
yes,
In
this
this
is
day and age, you need to ask them to produce some validation data which should be publicly available.
right. So when I checked with the company, then I went in the details of all of this. So then, anyway, I'll just tell you how we went ahead. So we explained to the patient that, look, this is the situation. Your genetic testing has come out positive. It's a non-seeing eye, and if you want, we can undergo if you want, we can do an enucleation, but the probability that it's a retinoblastoma may not be there. So with an informed consent, if you're willing to go for enucleation, we can do the surgery, because that will take care of this problem once and for all. Otherwise, you'll have to be on, recurrent follow-up. And because the company also told us very categorically that maybe it's not a RB now, but if there is a RB1 mutation positive in the blood, then in the future, this child is likely to develop retinoblastoma, not just in this eye, but in the other eye also.
So that's German RB. 90% of them manifest by age 2.5. The child is already 3 years old.
Yeah.
Okay, so that event is very, very
Unlikely, right?
So
Yeah.
they're giving you bullshit. Let me be very clear.
Yeah. So that's precisely why I'm presenting the case here, so that I can go back and tell them that you're giving us bullshit.
That's right. I mean, this is what it is. So you do a test, you spend some money, and doesn't take you to the right place.
Okay, right. So anyway, we went ahead with enucleation, but histopathology report was this. Dysplastic retinal cells with foci of calcification, bone formation, no evidence of malignancy.
the name of the company so we can kind of
Yeah,
figure out?
I've cropped it for now. So now the
You don't
question,
use them anymore.
no, now we, yeah. So, but I don't know whether we should go to another company or the same one for systemic genetic testing. So, question here, was the genetic testing reliable? Then, if it was, it's positive in a unilateral case, so this child requires more surveillance, assuming that the child has an RB1 mutation. It requires a greater degree of surveillance. He may be prone to increased risk for cancers, not just RB. And then we should do testing of parents and family members for genetic counseling. But if it is not, then what are the alternative tests? Should we go for MLPA, microarray, or other testing where this can say that no, this is not a correct finding?
So let's say they were right in saying the child has RB1 mutation.
Yeah.
If you have RB1 mutation, 90% will manifest the disease, and most of it by 2.5. So that hasn't happened. The child is going to become 3 years old, otherwise will be uninvolved.
So they yeah,
And
true.
child doesn't have trilateral disease, you do the
Mm.
MRI, otherwise negative. This child doesn't have RB, this child doesn't have RB. So I would say, from the traditional understanding of retinoblastoma, this child does not have retinoblastoma. Now you have a test that's positive. If you don't know the validity of that test, so the company has to produce validation data. How have they tested positivity, negativity of the test? If they cannot produce it, they should not be doing the service. You take them to ombudsman or whatever the authorities are. This is total, like it's not service to anybody. It creates more confusion than anything else.
Yeah, absolutely. And this is one of the most reputed companies, without naming, but this is one of the most reputed companies which are doing genetic testing left, right, and center for all these cases.
You let them know about this case.
I did. I asked them what should I do now. They were like very confident that our results can't go wrong. Then I went back to the pathologist. I said, do some more sections and see, if you can find any evidence of tumor cells anywhere. Hmm?
Take another blood test and enough.
Yeah, we can do that. Plus, we'll also now be testing the parents to look, because if it's in the blood, then maybe there are asymptomatic carriers. So we will need to go back to the parents. But then,
More remote possibility.
yeah. But
So-
for now, I went back to the company and I went back to the pathologist and tried to get a concordance. But both of them are super confident that their testing is fine and their pathology report is flawless.
So my question, my further comment is that if you want to go further with enucleation, just do the genetic testing from the samples, from the intraocular materials.
Right. Now yeah, that's a great point. So now we will do the tumor tissue. But so I want to, yeah, there's no tumor. That's the thing. There's no RB. Yeah. The, yeah, there's no tumor. And the test is positive. And so has anybody had this kind of experience where you've had a positive genetic testing and a negative tumor?
For retinoblastoma to happen, both the mutations have been present in the tumor. So first there has to be a tumor and there's no tumor. So that finishes the discussion. There is a tumor to show you the mutation. There isn't.
There isn't.
So
But it's in the blood, right? So that's the problem.
no. The problem is it's not there. It's just a misinterpretation.
Okay.
That's what it's telling us. Every way you look at this, there's no retinoblastoma.
So does that mean that in future we have a situation like this where clinically an imaging doesn't look like an RB and we have a positive genetic testing? Can we just leave the child and keep under follow-up? Is that the way to go about it?
So
Next time we have a patient, because we keep having these very often such cases that don't look like RB.
So you should choose a different lab. You
Okay.
take the next sample and send to other reputable lab,
Or maybe we send to 2 different labs.
okay, and then let them tell
Yeah. No, we do that very often. Such cases we always keep under close follow up. And we know if it is growing or it is showing. So we usually keep them under close follow up. We don't really jump into genetic testing for everyone. But in this case, we did. And somehow it just turned out to be, unexpected. Yeah.
Yeah, yeah. In nucleus, nobody is questioning that judgment. It's the rest of this interpretation of the testing. So unless the company has to come up with some data, we don't know what it means.
Yeah, and we just don't know what we have learned from this case, whether we should change our strategy, do genetic testing in all the cases, rely on it or not rely on it, or just, switch to our old strategy of just keeping all these patients under clinical follow-up and depending more on our clinical judgment rather than on these tests. Thank you.